Let's learn about the nasal septum. Nasal septum is an important structure which gives beauty to the face. It is a midline structure which divides the nasal cavity into right nasal cavity and left nasal cavity. The nasal septum also gives support to the tip and dorsum of the nose. It gives the shape to the external contour of the nose. When there is a pathology or when excess part of nasal septum is removed, when pathologies like tuberculosis, syphilis, or septal abscess following trauma, which leads to the septal damage, may leads to depressed nasal bone. So nasal septum plays an important role, and let's see the parts of nasal septum. The nasal septum is divided into three parts. First is columnar nasal septum, second is a membranous nasal septum, third is the nasal septum proper. Let's see each of this. Imagine this as a nasal septum. The first part is the columnar nasal septum. The columnar nasal septum is the apex of the nasal septum, and it is formed by medial crurus of the alar cartilage on either sides and joined with the skin. These two medial crurus are joined in the midline with the help of a fibrous cartilage. This is the image showing the columnar nasal septum. This is alar cartilage, and this is the lateral crura, and this is the medial crura of one side, and this is the medial crura of opposite side. When these two medial cruras are joined in between with the help of fibrous tissue, then this forms the columnar part of nasal septum. When there is deviation, it is seen like this. So this is called the caudal DNS. Caudal deviated nasal septum. This is the image showing the normal straightened nasal septum, and this is the caudal deviated nasal septum, C-shaped deviated septum. Next, moving on to the membranous part. The membranous part of the nasal septum does not have any cartilage or bony part. It is just approximated with the skin on either sides. This is the second part, that is membranous nasal septum. Moving on to the nasal septum proper. The nasal septum proper is the osteocartilaginous part. That is, osteo means bone, and it has both bone and cartilage. So it is called the osteocartilaginous part. The cartilage is cartilage called septal cartilage, which is also called the quadrangular cartilage due to its shape, which resembles a quadrangular structure. It is also called the septal cartilage or quadrangular cartilage. Moving on to the bony part. When a perpendicular line is drawn, and this is the perpendicular plate of ethmoid. This is vomer, and this is the perpendicular plate of ethmoid. These are the two main bony parts contributing to the nasal septum. Apart from this, we have some minor contributions. They are: posteriorly we have rostrum of sphenoid, and at the floor we have anterior spine of maxilla, anterior nasal spine of maxilla, crest of maxilla, and palatine bone, crest of palatine bone, and anteriorly we have nasal process of frontal bone and crest of nasal spine. These are some minor contributions for the nasal septum. Let's see the diagrammatic representation. This is the diagram showing the nasal septum and its parts. Let's see a small recap. The nasal septum anatomy has three parts. The first part is the columnar septum, which is formed by the two medial cruras on either sides, and membranous septum. It does not have any septum, any bony part or cartilaginous part. This is the second part. And third part is the nasal septum proper, which is osteocartilaginous part. That is, it has both bony part and cartilaginous part. The main cartilage is the septal cartilage, which is also called the quadrangular cartilage because of the quadrangular shape. Some of the clinical importance of this quadrangular cartilage is when the septal cartilage is diseased with disease like tuberculosis, syphilis, or when there is septal hematoma, or when a major part of the septal cartilage is removed, it leads to the depressed nasal bone. Superiorly, this septal cartilage is attached to the upper lateral cartilage of the external nose. So whenever there is deviation of this septal cartilage superiorly, there is also deviation of the external nose. And inferiorly, this septal cartilage is supported with the help of this anterior nasal spine of maxilla. So whenever there is a slippage or a defect at this level, anterior nasal spine of maxilla, this leads to the caudal DNS. This is the reason for caudal DNS. And there is also attachment in between the vomer and the perpendicular plate of ethmoid where the septal cartilage is placed. When there is defect at this level, this leads to the septal spur formation. This leads to septal spur formation, and this to be corrected. Next, moving on to the bony parts, the main bony contributions for this nasal septums are perpendicular plate of ethmoid and vomer, and some of the minor contributions are posteriorly we have rostrum of sphenoid, and at the floor we have this anterior nasal spine of maxilla, crest of maxilla, and crest of palatine bone. And in front we have this frontal process, frontal bone, nasal spine of frontal bone, and crest of nasal bone. These are the contributions and anatomy of nasal septum.